All right, everyone, we're gonna get going in a timely fashion here. It is 3:45 PM. We're gonna call this Health and Human Services meeting to order if people feel like paying attention. All right, we're gonna start with DSS, Commissioner Gibson.
Good afternoon. We moved on the resolutions, both went for the point one this morning. One is to fill a full-time caseworker and any backfills created there.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And one is to fill a full-time community services aides and any backfills.
And I'll move that.
Second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Then I'll direct you very quickly to the monthly stats, and you can see the number of rooms we used in May, and the number of folks housed, and the number of families. And that is a most stat. It's not supposed to continue to get more difficult as it gets warmer. But that's what's happening. So you ask yourself why, and I brought this up last week. Well, our waiting list of people who are in hotels paying part of their own rent because they're ready for apartments and can't find them. So it's a very big issue. I do have a meeting scheduled, and Supervisor Adams is coming over to that. I've been contacted yet again by someone who would like to develop in the county. It's the second time that's happened this year. Is interested in developing, wants to come talk about it. This is a real estate developer, but is looking at property and the like. So, but I can't stress enough the work we're doing over here at the Housing Committee and just trying to foster on all points development. I mean, we don't have places for people to live. It's really showing up, and it's becoming quite costly.
So the commissioner pointed out, I think in our last meeting, where we talked about the fact that if the wellness center goes ahead, that's 25, maybe plus 10 more beds, that's 35 beds. We currently need 150. So, and I learned something last week that I hadn't known before, is that the state requests that these housing units be limited to 25 people. So the wellness center is really at the top of what we can expect to produce, which means that that's going to hit 1/5 to 1/6 of our population, and it's 2 years out. So we really need to attach a sense of urgency to this.
No question. Do these numbers include folks that have Section 8 vouchers that can't find housing?
So, yes.
Is there a lot of overlap with that? Is there like a way that we can?
Well, there's more than you want. But then again, there's plenty of people out there with Section 8 who also find themselves in line, right? And this is a reversion, as you remember, Supervisor. We actually got to the top of that list and we're moving along just before COVID. Well, we've stepped back, but you can understand why we might have. And again, it always comes back to stock, right? Comes back to stock. So anything to develop is yeah. I would like to just very quickly. So the state has certain guidelines on their tier 2 shelters, and they don't limit it to 25. You'll
That's what I thought I understood.
yeah. So what you're hearing me say is when I go to operators who operate these tier 2 shelters, they say, look, you don't want to go beyond this number, and here's why you don't. So there's not a legal prohibition. There's not even a reg.
So it's a practical.
Is a practical matter, which is why we also would stick in 10 dormitory rooms. So you'd be looking at 35 as a capacity. To your point, it's still
And this time
remarkably shy of what we need.
And this time last year, that number would have been 40, 45 people as opposed to 150
No, we over 100 last year.
in May.
Let me see if I can go back that 440s.
Cold weather, I thought cold weather usually went to 50 or below last year. Okay,
Yeah, and
my bad.
no, it's not your bad. And I I go back, but not that far. So, you know, how about I send you over?
I can look it up on the website.
Would you?
Yeah,
Okay.
I'll do that. Thank you.
So I just want to bring that to your attention. I want to save time for our guest speaker too. So unless you have any further questions.
Thank you.
Okay, thank you.
Thank you, Bob. Thank you, Commissioner. Director Grandinetti is out of town. Next, we're gonna go up to Health Department. There she is.
Right on over to the table, sit right down. How's everyone doing?
Good, thank you.
Supervisor not. Supervisor not. Want to come up to the table?
Sure.
You're on
No.
committee.
I didn't want to interrupt.
Oh.
Sorry, I was late.
Couple of resolutions. First, request authorization to accept funding under the MRC strike.
Further discussion? All in favor?
Aye.
Opposed? Carried. We like accepting.
Yeah, that's what I
Yeah,
was saying.
yeah.
I have no doubt that.
Ready to be this one.
I'm getting another alert here, sorry. Request to authorize the health department to contract with an agency to provide related services for preschoolers. This is milestones for munchkins, OT.
I'll do that.
Second.
With a name like that. Yeah.
Yeah. Further discussion? All in favor?
Aye.
Opposed? Carried.
Request a contract with an occupational therapist for early intervention services. This is Mary Ann Watchell.
Second.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Request to contract with an agency to provide evaluations and services for preschoolers. This is Pine Plains School District.
Second. Further discussion? All in favor?
Aye.
Opposed? Carried.
Authorization to contract with a physical therapist for early intervention services. This is Nicole Santos, EPT.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
I have a question for you. Are these resolutions going through because of the new director? Are they things that we've been missing out on?
Nope, these are routinely renewed this time of year. It's very cyclical, the early intervention and preschool contracts. Next is a request for the county to be recognized as a medical reserve corps unit.
Do I have a motion?
Yes.
What would they actually do?
So Medical Reserve Corps is a federally recognized entity, and it's essentially an expansion of our Serve New York volunteers. The difference being that the Medical Reserve Corps will be a more engaged group. So we'll be doing more regular training so that when a disaster does occur, we have a trained, engaged group to call upon.
We've had 2 subcommittee meetings, which is including the health department, emergency management, and so on to, discuss this.
So in my emergency plan, as it currently stands, I would normally reach out to the Red Cross for this service, and now I would reach out to the county. What's the interface?
So this is part of a coordination with like emergency management, as the chairman mentioned. So it really would depend on the situation.
We should reach out to emergency management, probably.
Yes, so the Medical Reserve Corps will be medical professionals,
Mhm.
but there will also be non-medical professionals, because as we go into COVID, those, the non-medical piece, the logistics, were, we couldn't have run anything without, the data entry folks. Someone's got to buy lunch, right? I mean, the things like that were really essential to the operation, and, the medical folks obviously too, but it's important to have an engaged group that are,
So maybe I could get some more information on this, because it's not clear to me how this functions.
sure, yeah. I can do that for you.
Not necessarily here, but.
Can get that for you.
All right, I had a motion. Do I have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And I think this might be my final one, request to declare a vehicle
I'll move it.
surplus.
Second.
Further discussion? Sad to see that old Ford Focus go. All in favor?
Aye. You can think of it. You can have it.
And then.
See you at the auction.
We'll give it a try,
And then we've got my director's report here. Please let me know if you have any questions about anything. A lot of May was largely routine. We appreciate. Any questions?
Any questions for Director?
Any updates on the COVID vaccines in the fall, the new vaccine in the fall?
So it's unlikely that it'll be a dual vaccine, a flu and COVID. It will just be COVID. They are looking at creating a new formulation that targets the latest variation. But that is all the information we have so far.
Thanks.
People want to forget about COVID. I brought my mother to the emergency room in her primary care within a week and they didn't test her for COVID and she had all the COVID symptoms.
But we had a
They
community,
swore it was a tick-borne disease.
but we had a community day on Saturday and at least a half a dozen people asked me about the vaccinations in the fall. But I have an older community, so that may be their risk management plan. for them.
All right. Thank you, Director.
Just have one more thing to mention. Last month, I brought the 2023 annual report to your attention, at the committee, so I wanted to know if you had any questions about that. Or you can.
I think if nobody has, it can be released then.
Excellent. Thank you so much.
Thank you. You did a great job on that. Too, by the way. Thank you very much.
Thank you.
Okay, next up, Office for the Aging.
Fortunately, Nina couldn't be here tonight, so she went to the bullpen and pulled me in. We'll see.
So that means you're.
You haven't forgotten everything, right?
This is Ken Schumacher for anybody who doesn't.
Yep.
Yes.
Happy to see you.
Thank you. All right, so the first resolution we have is for a copy machine for our kitchen. The current lease has expired. And the new lease is about $12 to $13 less than the current one. So
Move
it. Cost savings there.
Yeah.
It's always a good thing.
Didn't I tell you not to put a copy machine in the kitchen? All in favor?
I didn't
Opposed?
think they make so much food at once.
Carried.
Yeah.
That's why we're replacing it so.
And then we're looking to enter an agreement with the Felicia Rescue Squad. They have a mobile integrated healthcare program in which they go into homes of individuals to do screenings, like blood pressure screenings, so they don't have to go to doctor's offices, urgent cares and stuff like that.
Second.
Yeah, it's good.
Saves a lot of trips.
Is
Yes.
is this something that's budgeted? Or,
It's not, there's no cost to us.
okay.
They have grant money that they're using for this program.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And the next item, we're looking for an approval for an official logo for our office. Or so as an identity for our programs.
I love the idea of the
I like it.
logo, but I think that this one is not going to be readable from a distance. The steel inside is hard to read. But so I'd love the idea of developing a logo, but I think this one is not ready for prime time.
Okay,
Would that be sharp? Can that be sharpened up or?
I can check with Nina. She's the one who developed it. She's
Also,
very much technical engaged.
the thought might be that rather than having a government seal, that we might have something that is related to people or as opposed to a government entity.
Okay.
Because it does serve, while it serves the county, it serves the people in the county. It would be warmer and fuzzier, is what I'm thinking.
Well recognized.
Do other departments have their own logos?
Many do.
What is the logo of the health department?
Is it on your,
What's this?
is it on your?
It's on your app, right?
Didn't we see something
Oh,
for the sign?
Right there.
Remember the
Yeah, I
sign?
do remember.
Yeah.
Nice.
They have the seal in the middle and it's very tiny. It just say Columbia County Department of Health.
I guess I'm curious, and I'm not blowing something up here as to why every department has a different logo. Why aren't we just having a logo that we then put the department? in?
Customized for each department.
Yeah. Just, I don't want to get into the whole, but I mean, it seems a little odd to me. And honestly, I've never paid attention to it, that we would have a different logo for every. You know, it's not as recognizable, frankly, as a Columbia County office. You know, let's just assume that that's our logo, and then in the middle, it's Columbia County Office of the Aging, it's Columbia County Health Department, it's Columbia County DSS. I don't know if that's ever been thought about, you know, as opposed to everybody having a different logo.
Well, that's what the state does. certainly they have the state one logo
Yeah.
that they customize for each one.
Yeah, I don't know. I don't want to start a whole
I could
thing
do
here,
some
but
research on that if you'd like, but
it
it's
just seems odd to me that every department would be, you know, you look at that and say, okay, well, what is that?
Supervisor Leon, if I may,
Yeah,
I'm not an expert, but I have a wife.
nor am I, just.
I have a wife that's a marketing expert, and when the mental health center specifically came before you to do a logo,
Mhm.
we don't have the county seal in it. You guys approved it.
Yeah, yeah,
I
yeah.
was grateful for that.
I didn't notice it then, was that?
The logic, the logic though of everybody independently having a logo is so they can market to their specific niche. So I agree with Supervisor Adams and that, you know, it's really off to the aging, and I'm not being critical. It should steer towards something like that, that the aging population gravitates towards it, sees it, and it's like, aha,
Okay.
such as mental health should have something that would, you know, kind of catch the eye of a person that is inquisitive, curious about mental health services and so on and so forth. If we standardized it with a county logo that goes across all departments, you could miss that opportunity. That's the logic that was explained to me, the value proposition, I should say.
I think this was like Caring Hands
Mhm.
is what she
No, I
was
like
going
the
for
Caring
the,
Hands. I
yeah,
think I like that
the
part.
Office for the Aging.
But I'm just thinking, I used to do marketing and when you are trying to enforce a brand, you're thinking about what you can read from a sign, what you can read from a business card. So I think that would be hard to read in many cases, but I think it doesn't hit that warm, it doesn't hit its target market.
What was like to see between those palms?
I think we should leave that up to somebody who does that for a living. I mean, I don't, you know, I used to hire people to do that. I didn't do the work myself.
So the resolution on the floor is to develop a new logo. Not necessarily without this one.
Well, no, this says approval of new Office of the Aging
So
logo.
I'd like to either
Table.
either table it or amend it, one or the other, to approve the concept, but to whichever you think is easier.
Well, we can't obviously approve this.
We can approve the concept of the office having a
I
logo.
think we did that.
We did already.
Yeah, we
This
did,
is
we did
to
it,
approve the
approval
logo.
for development.
So then it has to be-
And this has to be
You table.
tabled. I'd make the motion to table it.
Do I have a second?
Second.
For discussion, all in favor? Aye. Opposed?
It's a great tagline, the tagline, caring for those who cared for us, I think reaches that audience that we're talking about,
Yeah, we've had that for a long time.
but I still
And
like
it's,
it.
She's liked it for a long time.
Yeah, probably a long time.
we'll put a baseball in there.
Yeah.
No, put a pickleball in there and then all.
Come on.
All right.
I think you're on the
She has
right,
update.
I do have something, I think you're on the right with this.
Yeah.
The
There's something.
the ability to
recognizable
see
in
something, because, you know, a lot of people, if you're going through the Office for the Aging, you know, they had visual problems, they had,
it. Mhm.
where they couldn't read it anyway, so that little logo in the middle,
It's hard.
it's what they're gonna see, so the Caring Hands, I understand the concept of like, oh, that's, you know.
We do a meal program, we can put burger in there or something.
There you go.
But I will point out that that is our logo.
Mhm.
And I hate to get away from that totally.
Sorry.
So we have updates here. One event that's not on there was this past weekend in Canaan. We were at the community day, which was kind of interesting. Like coming to work Monday, the girl, Katie Campbell, who manned it, I asked her if she wanted to unload the car, needed help with it. And she said, yes. And then she goes, are you retiring? I'm like, am I retiring? She goes, yeah. At the end of the day, my sister came to the table, introduced herself, and said something about me retiring. I'm like, this is news to me. So I think she heard something from my mother, and my mother screwed up the story. My wife actually retired back in March, so, and maybe I am retiring. I haven't seen.
Maybe your wife doesn't.
Are you softening us up with this conversation?
I wish I could say one way or not. It was news to me, so interesting outcome from that. Any questions on the plans going forward?
It's great to see all these external events happening.
Yeah, that's
Truly, there's a lot of things going on.
Farmer market coupons have been delivered to our department. We got them this week, so we're getting ready to disperse them.
And the sheriff and the undersheriff were at Community Day, and they thanked the women from the Office of Aging for having the sheriff's programs out there, the yellow dot, something else.
Oh, yes, we got the yellow dots going.
Yeah.
Had that for a number of years. And they'll be at our community day in September. They'll have a medical dispensary they're going to. Working towards that. And we also found out, just to lead in this a little bit, our 50th anniversary is next year.
Hmm.
So we're hoping to maybe celebrate in some way, like spread it over the year or something. So, yeah.
Yeah, that took a little research to figure that out, that it was 50 years. I mean,
Yeah.
well, it was on your website.
Yeah,
correct?
it's doubled across that. We're working on a newsletter, and I usually go to other counties to see what they're featuring and see if there's any good ideas there. And one of the counties is in the process of celebrating. I'm like, oh, we gotta be close to 50. Maybe we missed it. I didn't know. So, as I'm looking through stuff, it looks like 74 was or 75 was the year we filed. So that's gonna be a focus kind of next year.
Very cool. Very cool.
Thank you.
Any further questions for Office of the Aging? Okay, I'll allow one from the public, sure.
What are the farmers markets coupons? And then also my second question is, how do you publicize these services? I never heard of any of these.
We have our newsletter that we do that goes out quarterly. We also do it on Facebook. And we now have what we call a robot call system, where we can call seniors we have and let them make them aware, which I think we were doing one with the heat advisory, and we'll be doing more as we become aware of cooling stations. So we have a couple mechanisms that we have out there. And we have our website, which is being redeveloped right now.
We've got great nice booklets that I know we hand out in town that have all the services in it, but I
Yeah,
did some years ago, they're available.
The
Seniors,
farmers market coupons are what?
they're a packet of $25, $5 coupons that they can use that at farmer markets that accept them.
Who's that?
Seniors.
How do people get them? And
Well, we are going out into the field, distributing them at senior clubs. We're going to our meal sites. We go to town halls, some libraries. We have a whole list of them. And I think they're on our website now.
So we'll make sure before you leave that we have the website provided to you.
But
You know,
also
we-
the town member to the council, the senior council would have
Yeah,
all
the
of the
delegate.
information. You take back to the town.
You know, it's-
Every town is a member on the senior council.
Probably starts just after 4th of July or around that time. It might start before that. I'm not sure the exact starting date, but we go around the county. They can come to our agency. People do call, they show up, they come to our doors and we hand them out. Yeah, we pretty busy the next month getting distributing them right through August, I believe.
All right, thank you, sir.
Thank you all.
Thanks, Ken. Glad you're sticking around.
Hard to know.
All right, up next, Director Almasi, Human Services.
Good afternoon, everybody.
Good afternoon.
Keep a total of 6 resolutions to present to you today. I'll kick it off with a financial resolution. We're looking to surplus a vehicle. So I'll raise you that Ford Focus for a minivan.
The old caravan, all right. All in favor?
Aye.
Opposed, carried.
Brings me to the first of 3 personnel resolutions. The first one has to do with a resignation, so I ask for your support to backfill a vacant and budgeted behavioral and social worker position.
Further discussion? All in favor?
Aye.
Opposed, carried.
We have plenty of time, and Hannah Calhoun, the guest speaker, is not here yet, so. Okay.
Slow down.
She's on her way. She's on her way. Second, personnel resolution is similar to the first one due to another, separate resignation, of a behavioral health social worker. So similarly, thank you.
Further discussion? All in favor?
Aye.
Opposed, carried.
And then the third personnel resolution, slightly different but similar, backfill a vacant budgeted account clerk position.
I'll move that one.
Second.
Further discussion? All in favor? Aye. Opposed? Carries.
Thank you for your support on those resolutions. Moving on to general resolutions. We'd like to get your support on formulating a contract with Adelphi University. This would just codify the relationship between the county / our department and Adelphi so that we can have MSW students.
I'll move that.
That's a great idea. I'll
Yeah.
second it.
Second. Further discussion? All in favor? Aye. Opposed? Carried.
And then the last general resolution has to do with contracting with the mental health, substance abuse related gallery run by Brian Belt here in the city of Hudson. We have used not the county's opioid settlement dollars, but what I refer to as abatement dollars that come directly to the local governmental unit to support and help Brian mostly cover the rental expense for the space. I think he's doing amazing work for people with mental health and substance use disorders. They are the artists. They are also teaching people. And there was just recently a conversation, I believe, with Brian Belt and Judge Cheryl Roberts in terms of some of the individuals involved with the Hudson Behavioral Health Treatment Court as an alternative to going and receiving what we would call clinical services, talk therapy, maybe going and taking one of these art classes and helping themselves that way. More information to come on that, but I just want to support this effort because I personally know the value of alternative types of ways to get better. Talk therapy is not for everybody. And
I'll
so
move
I
it.
just want to support Brian's efforts in this.
Further discussion? All in favor? Aye. Opposed? Carried.
Thank you. So I can talk about the overtime report that you have in front of you.
For 15 minutes.
Well, I do have a director's report that I was gonna just say, let's pass on that, and let Hannah go, but maybe we'll talk about that. So as you can see, $12,000, what we budget for the overtime report, we've used all of a little over $1,500, brings us to a final balance, remaining balance as we approach the pretty much the halfway mark through the year, $10,487.89. So we're being mindful of that. We always go well under there. So those are all the resolutions. Happy to talk about my director's report or entertain questions. I can walk us through it as I've done in the past. Or
Where's the county share at the opioid settlement fund?
where is it? Yes. So what we've done, the two major commitments that we've done are the Oxford House Incorporated. I can offer a refresher on what that is if people need me to. Otherwise, I can tell you that that's in the stages of the contract being signed. I don't know if it's made it to your desk yet. I signed it. I think it went to the county attorneys to review. We did, but I think it marinated on the Oxford House Incorporated end for a while.
Yep.
And it's since returned to Columbia County. So we're in good shape there. I mean, once all the ink dries on that, the coordinator that we're paying for, that's where the bulk of the money is going, will be assigned to Columbia and Greene County, because remember, we're splitting the cost, and there will be one house identified and hopefully found, a landlord that's willing to rent to Oxford House Incorporated for men here in Columbia County, and one for women in Greene County. Not to say that Columbia County women cannot go to the women's house in Greene County and vice versa. There will be a, cross pollination.
Subject to
Yeah,
capacity.
subject to capacity, of course. And
But are you saying that Greene County treats their women better?
no, the logic is simply, curveballs are unnecessary here, Chairman. I'm doing the best I can.
Columbia County troops are running that, right?
And then we digress. So the logic was because there is a community residence for women known as the Riverside Community Residence that serves women through Twin Counties located at Catskill. We here in Columbia County, the Twin Counties, have the Red Door for men right on Columbia Street. So in speaking to the director of residential services for Twin County, she assured me that, they could definitely keep the Oxford houses full because right now they're holding on to residents in those community residence
beyond their discharge date because they're reluctant to discharge them homeless. So there's nowhere for them to go, so they hold them. And Renee Pine, who's the director, was saying she can definitely make referrals to each of these houses. So we'll just have to, have the ink dry, get this coordinator, introduce them to as many potential landlords as possible that have inventory. This is going to be our biggest problem. You'll see, I'll talk more about that when I discuss some of the elements of my report. It's this housing inventory that is likely going to be problematic for us at this point.
Do you think that the Oxford House will become like procedurally always the next step after Red Door and the Women's House in Catskill?
It certainly makes sense, Supervisor. It does in terms of the continuum. When an individual starts out, they may have a level of need that requires detoxification and then inpatient substance abuse services. They, for them to go directly home to that environment that they left, because that may not be the best place for them. But they graduate from inpatient and they go to Twin Counties for outpatient. But where do they live? Often we place them at Riverside or Red Door because that's a safe place with boundaries, structure, staff on site, support. But they can't live under that sort of rule-based environment forever. So this would be a step down from that, where it would be their peers. Remember, this would be a house of 6 to 8 men or women, and they would govern themselves. They would hold one another accountable. There's tremendous value in that. So I do see a progression. It doesn't have to be that way.
I was gonna say, do you see that deterring people in the public from applying for the service, or is there a way that you're gonna help service providers remember to make this referral to regular folks
Yeah.
that are coming in that are
Yeah,
not participating in the
the availability of a bed would be available to anybody. Our goal here is to fill any vacancy with a Columbia County or at least Greene County resident. Greene County feels the same way. They want to fill it with a Greene County resident. We want to fill it with a Columbia County resident. So this coordinator, this individual at Oxford House will be providing, and if we are paying for with the opioid settlement funds, their job, their sole purpose is to work with the providers throughout the community and attend meetings and have their finger on the pulse of who needs a bed. And remember, the bulk of the money that we're spending is for the coordinator and all the administrative charges and this and that to Oxford House Incorporated. To set up another house is relatively inexpensive. You have to find a landlord. You have to find a landlord with a house that's available. And then it's $20,000 to furnish that house soup to nuts, whether it's soup, spoons, knives, forks, blankets, drapes, furniture, you name it, to make that house inhabitable. It's 20 grand. So we can grow this model in $20,000 increments. For example, we're only doing one house, technically two, right? One here, one in Greene County. But Dutchess and Orange County kicked this off with 4 houses. That was their initial contract. Now they're much larger. They have greater population and density, so they could do that. I wanted to be judicious and make sure we do this right and successful and grow in a way that is indicated, not be reckless about this.
I think that's smart. I think also you should push it further, and in the housing conversations, think of this as a viable solution. If we know that it's only going to be $20,000 to open another house, and we're thinking of the homeless population, how many of them have substance abuse issues, that we use this as a solution going
Right.
forward instead of automatically like constructing new housing. We do have this project that would house more people if we could get another house.
It would. I think we're taking multiple cracks at the problem. That's what's got me excited. And I want to finish my answer to the chairman. The other thing that we've done, remember, is that you supported a resolution that involved expanding Columbia Reentry, the nonprofit that works with individuals who are returning from jail and prison to Columbia County as their home base. That was previously operated at a part-time executive director, Lori Scott, who really honestly worked in a full-time capacity. Danielle Hoteling has come on board. She is working in a proper full-time capacity as the director. And then she had a case manager, full-time case manager. So we've expanded that by an additional FTE. So it's an executive director and 2 FTEs right now. And Danielle was part of the opioid settlement work group, brought this up, not necessarily to serve her own needs, which said, hey, you know, we have the kind of volume returning to Columbia County that could justify this. And, you know, based on my presentation, I forget how many months ago you supported that. The next thing that we're doing that we haven't committed any funds to is in response to what we heard from all of those community listening sessions that we did. There were 4 of them strategically throughout the county, in hopes to, you know, catch as many people as possible. Is they were asking for some sort of clearinghouse is the best way I can put it. They appreciated the fact there's multiple warm lines, hotlines, helplines, etc., being advertised and talked about. We're all trying to do our best to market ourselves and make our information known. But for the individual, when they have that moment of need, whether it's because a loved one needs mental health or substance abuse treatment, or they have a clothing need or a food need, whatever that need may be, they are paralyzed to then navigate this very overwhelming system. I'll be honest, me as a provider, sometimes I feel frustrated at navigating the system that we work in day to day. And I know it. So for, you know, Joe or JQ Public to navigate this is overwhelming. So what they were asking is, can we somehow make it simple? Make it so that there's a one-stop shop of sorts. So we're in conversations as a work group about what would be the best way to do that. Who already has maybe the bones or the skeleton of some sort of a system that we could then market to the public. And this would require a hefty marketing campaign, and it would have to go on for a period of time to educate our local community on, okay, if you have a problem, this is who you call, and they will then put you in touch with that applicable warm line, hotline, resource, pantry, service provider, etc.
That's
And-
not care coordination, that's different.
Well, not everybody's eligible for care coordination, but yet that's a lot, it's a sort of the work that care coordination does.
Is that a little bit like the program that Healthcare Consortium does? Is it New York
Connect- New York
Reconnect?
Connects.
Yeah.
Yes, technically that's for the aged population, but Claire Pardee, who is part of our work group, has explained that, you know, it's much more than that. That was one of the services, existing services that we considered. I'll be honest with you, I don't want to get ahead of myself.
Like your model.
We are looking at the Department of Human Services crisis line. You may know, if you don't, I'll happily educate you, that during business hours, we have a crisis assessment team, primary and backup screener, who are always ready to talk to somebody on the telephone or manage a walk-in individual, whether they're open to the clinic or not, whether they're a Columbia County resident or not. We will mitigate their crisis and what's going on and try to, you know, resolve it or refer them or connect them. So that's around behavioral health crises specific. However, I can tell you, we get a lot of the other types of calls as well, that, hey, I need food, or hey, my child needs this service, or what can I do that about this, or where can I go to get that? So we are kind of already doing this, but there would be a lift involved. So we're exploring, you know, whether the Department of Human Services is the better fit for this. We haven't made a decision yet, but it would require some funds for the marketing element of it. Because look, Columbia County is what, 61 and some odd thousand residents. That moment that they're going to need this information is only going to come up intermittently. So they may ignore this marketing for months or years until that moment comes in their life where they're like, wait a minute, I need to know what to do or where to go. So that marketing will have to have resonated and penetrated the essence of this community in the way that, hey, everybody knows if your house is on fire, who do you call? 911. You know, I'm a little dramatic in that explanation, but you get what I mean.
I also hope it'll be a little bit turnkey, because I know in helping people in my community, you call and you give them a resource, that resource doesn't work, and then they think, okay, that number, that person didn't work. Well, in fact, there's a whole menu of resources.
Yes.
They just exhausted the first one.
That's
So if the first one doesn't work, where do I go next?
Yes, and I want them to also, what we heard in the community listening sessions is that, you know, there's no follow through.
Right.
So person calls, they might get information, or they leave a voicemail and nobody calls them back. That's a miss. That can't be tolerated. So, you know, our workers would be committed to, if they can't give an informational nugget to direct that person towards a resource, then they say, I will get back to you by close of business, or I will have my colleague follow up with you the following day. And there will be a mechanism to make sure that that loop is closed. So those are the types of things that the funding is being used for. Keep in mind, last time I checked with Jim Breed, we have only received just shy of $500,000 of the 1.1 or 1.2 million. The rest will be trickling in over a very, very slow period of time. So between Oxford House, maintaining this one FTE commitment, and the marketing, I mean, we might be close to having burned through the 480 or whatever it is, $1,000. So we're mindful of that too. We're keeping an eye on that amount because we don't want to overspend. So hopefully that answers your question, Chairman.
Didn't we add a little bit to a petty cash pool as well for instantaneous acute?
Yes, you're talking
expenses?
about the opioid flex funds. Thank you, Chairman. That is coming out of the opioid abatement.
Abatement, okay, I'm sorry.
We increased that to a solid $50,000. And, I can invite the individual from my department that is spearheading that to talk about that, but just anecdotally speaking, I can tell you it's working wonderfully. There have not been any, what I would call unpleasant headlines where people misuse the funds. It is resonating in the way that we hoped and intended. It is helping people cut through the bureaucratic red tape, and getting them the money that they need so that they can clear up issues with their license, court fees, application fees, finding housing in a decent hotel, let's say, to bridge the gap between when their housing can kick in. We're paying security deposits. There's a process to screen people, but it's not. It's very simple and plain. So that's moving along really well.
Before you move to your presenter, can I just share an appreciation?
Sure.
I had a bad experience with mental health a long, long time ago, and I needed to bring my son in for crisis intervention during their office hours, and they were able to help us secure an inpatient bed for my 8-year-old, and he was there for a month, and I haven't seen my boy this happy in a really long time. So I truly appreciate the direction the department is going with these open office hours.
Thank you very much. I appreciate that. I'm glad we were able to help. So with that, I think Hannah has entered the room. Hi, Hannah.
Hi.
You want to take over the seat or join me up here?
Yeah, wherever.
Right here. I'll let you introduce yourself, if that's okay.
Hi.
And if anybody has questions about the director's report, which was shared with you, please email me, call me, reach out to me, or I can discuss it in greater length next time. Be happy to do so.
All right, thank you, Director Amo. Hello.
Hi, thanks for having me. Thanks for inviting me. My name is Hannah Calhoun. I'm the Executive Director of the Columbia Green Addiction Coalition. I did send a presentation. I wasn't sure if that's. Oh, I saw that there. Sorry. I thought you were looking at it. I apologize.
So Hannah, while she's doing that, you have multiple supervisors from the county here, so introduce yourself, everybody.
David Helsley, Town Germantown.
Brenda Adams, Canaan, New York.
Ron Knott, Town Stuyvesant.
Ralph Begonia, Town of Austerlitz.
Matt Morrell, Town of Stockport.
And Denal, Town of Chatham. Nice to meet you.
Nice to meet you.
And of course,
Kelly, how are you?
Kelly
Nice
DeCarry,
to meet you.
hardest working woman in Columbia County.
Yeah.
Here, here.
Well, I'm a Columbia County local, born and raised in Chatham. The town my life, so thanks for having me. So I had presented we have a monthly coalition meeting, and I had presented this to the group, and Dan had asked if I would just come and present it to this group. No, I know I don't have a ton of time, so I can obviously get through it. But for anyone who doesn't know, CGAC was established in 2012, 2013 at CMH as a response to the growing opioid crisis that was emerging at that time. Initially, the coalition was focusing on prevention initiatives and the overprescribing of pain medication. And then there was a lot of time in between that and when I got on board in 2022. So I can't really speak to all that was done. But we did participate in this very large
national multi-state study called the Healing Communities Study. Columbia and Greene counties were actually identified in wave one of that study out of 67 counties total. And the study was focusing on opioid misuse and overdose, and their goal was to prevent overdoses by 40% over 4 years. So I came on board November 2022. I helped lead the coalition into incorporation as a 501c3 nonprofit. We did that in January 2023. And then in September 2023, we were awarded $1.4 million in federal and state funding that we had applied to in March and July. The two grants that we've received, we have the Drug Free Communities Grant. This is a federal grant program through the Office of National Drug Control Policy and the CDC. And we also have the Oasis 4Rx Prevention Coalition Grant, and that money is through opioid settlement
Can I
dollars.
just interrupt you for a minute?
Yes.
I want to just focus in on that. Just think about that. In her short tenure as an executive director, coming into this role, she was successful in not only transitioning a coalition, which at that point, this coalition, some of you may remember, was previously co-chaired by Michael Cole, my predecessor, and his counterpart, Maggie Brand from Greene County. There was a tremendous amount of good work done, but then the pandemic came along and it fizzled. Michael and Maggie both retired. Jason Fredenberg, who's my counterpart in Greene, and myself took it over. But look, we are trying to drink from a fire hose on a good day with all of the tasks that we have. So we made a decision to look for an executive director, and one of the directives that we gave our executive director, E.G. Hanna, was to form the coalition into a nonprofit. That alone is a big task. Then on top of it, to secure grants, which you're, no offense, not a grant writing guru. You are now because you've been successful. But, you know, Hannah was faced with some huge challenges, and to land 2 for 2, right? Two
Yeah.
grant applications, 2 successful grants being landed is huge. So I just want to emphasize that because this is amazing. And the work that's being done, which Hannah's on the letter talk about, is also amazing. But we are in good hands with regard to this.
Thank you.
So thank you for that. But before you move to the
Yep.
slide, what's the classification wave one mean?
So basically, there are 3 waves of this study, and the classification is that while in 2021, Greene County ranked #1 in New York State outside of New York City for overdose deaths involving opioids. So, and I think the reason that Columbia, though our rates are not as high as Greene, they are still quite high. And I think what's important to remember is that the reason why these 2 counties were lumped together is because we share so many resources.
Thank you.
So where are we now? We've got staff, we have volunteers, we have an assistant director over in Greene County who is leading much of the grant management. We also have a research data analyst. We have a youth coalition coordinator who is working to lead efforts to build youth involvement. We have a part-time outreach coordinator who is working to increase visibility, and we have several volunteers. We also have a volunteer sign up on our website if anyone's interested in getting involved. We're always looking for volunteers. Yeah. So what have we been up to? So it's important to understand that we are working through the SAMHSA Strategic Prevention Framework, right? And at the top of this flower is the assessment and capacity building. So in the last 6 months of having this grant, we have been focusing heavily on these 2 functions, assessment and capacity. We've administered these prevention needs surveys in 2 Greene County districts in the fall of 2023, and we are working to administer them additionally in the fall of 2024 in Columbia County as well as Greene County. And this really gives us like baseline data for consumption patterns, past 30-day use, risk and protective factors, and local conditions for youth from 12 to 18. We also are just on the cusp of starting some listening sessions / focus groups with youth, parents, and other community members. And we are also using this community readiness assessment. We have an online survey on our website, and we'll also be doing some other stakeholder interviews.
And the youth outreach was prevalent in the listening session I attended to in Chatham at the firehouse there. Yeah, there was a heavy call for that. It's just terrific.
Yeah, Columbia and Greene counties are recognized as prevention deserts when it comes to prevention education, especially in the more rural parts. So prevention is a huge topic. It's not always the most sexy topic. I don't know if it's appropriate to say that, but yeah, prevention is not something that is like widely kind of understood and utilized. And so we really are focusing a lot on prevention.
But it's also really important because almost everybody either has been or knows someone who has been touched by this.
Yeah, absolutely.
Some other grant objectives. So beyond the coalition capacity, and you know, collecting data is implementing strategies that will ultimately lead to preventing underage drinking, marijuana use, and prescription drug misuse through the use of environmental change strategies. So either individual or environmental. Some of the change strategies we're just working on are very basic. So providing information, building skills, reducing access, and reducing or increasing access. And we have not worked on change physical design. That's obviously down the line.
Thank you.
Can I just jump in one more
Yeah.
time? Yeah, I just want to emphasize, we couldn't be at a more critical time for something like this. Let's just think about this for a moment. Our young people, our students, grades K through 12, have been through a period of remote learning for about 2 years. The impacts of that have been devastating. All you have to do is talk to a teacher, a superintendent, a principal, a parent. They will tell you that. So that cohort, that group of people in our society are struggling. They will be looking, trust me, for something to alter their mood, to medicate themselves, to make themselves feel differently or better, or however you want to characterize it. The prevention efforts that are underway are our attempt to counteract that, to at least give that young person, and not just young people, prevention is going on at the adult level as well, but we're talking about young people, to help those young people understand that there are different ways to cope, there are different ways to manage. You don't have to, turn to these potentially devastating and harmful ways. Lord knows there's a lot of ways to alter one's mood nowadays, some legal, some still illegal, but it seems like they're popping up all over the place, whether they're synthetic or, just straight old cannabis, which isn't the pot from the 60s. I can assure you the level, the percentage of THC is astronomically higher and more problematic than the stuff that was around a long, long time ago.
Yeah.
So, thank you.
And
So if
yeah.
I could just follow up, then what are those options and where are we getting into the minds of kids? So, right, they would be inclined to start to medicate, right? They'd be inclined to sort of start to drift. And there's a reason, obviously, for that, right? There's a very good reason. So what are we getting into their minds and what are we putting before them that says, yeah, this is going to address that void?
Yeah. So a lot of the evidence-based strategies out there for prevention really come down to the family dynamic, right? The parents' perceived attitudes. There's a lot of research out there that says if parents are sending consistent messages to their children that, drug use is harmful and it can lead to, really bad things and we want to stay safe and we want to stay healthy, and communicating to young people from the age of 5, really. Like if my son takes, like a multivitamin and gummy, right? And so explaining to him, hey, you take this once a day when your mom gives it to you. You don't ever take it unless I give it to you, right? And so just starting to have these age-appropriate conversations, because some of the data that we did collect, though it was not a lot from Greene County, really showed that a lot of the young people were either getting substances from their parents or it was okay that they were using, like their parents were okay with them using substances. So a huge part is just educating and supporting parents, right?
What if you don't have that type of parent in the home?
Yeah. Yeah. I mean, I don't have all the answers, but that's a part to it, right? That's a piece of it. Being connected to school is another huge risk factor. Some of the data that we collected in Greene showed really high rates of, lack of connection, really high rates of suspension. We know that when we are suspending young people for periods of time, the risk of them using substances increases, right? So it's just supporting young people to make healthy decisions. And also, research is indicating that obviously just say no doesn't work. We have to equip young people with tools. It's a harm reduction model, right? So supporting them to make safe decisions.
Thank you.
Yeah.
Are some of the building skills around like helping young people identify, like, they don't think that they're filling a void, and helping them realize that they are seeking it because they're trying to fill a void, or like what's the prevention before the prevention? Like, how are you catching kids?
Yeah, I mean, that's a good question. And this is why we have meetings to talk about it and figure it out. But I think peer-to-peer can be really impactful. So if you have groups in schools that can offer peer-to-peer education and support, that can be, really helpful. Can you go to the next slide? It's really important that our coalition encompasses these 12 sectors. Both of the grants that we have require involvement from these sectors. And we do have meetings, like I said, on a bi-monthly basis. We try to include all these sectors. We typically run short when it comes to media showing up to meetings. We understand that. As well as, there was another one, media, businesses, and then youth are hard to really get to come to a meeting. So we are doing other types of outreach to include them in any decision making that happens.
Summer camps.
Right. Yeah, exactly. And so this just a lot of this just goes along with capacity building. Again, this is the focus right now of the money that we have, right? So we work with Mental Health Association, their youth clubhouses, to coordinate informational sessions. We have done a number of those. We supply lots of Narcan. We train participants, so that's building skills. We also supply these medication disposal bags and just basic information and awareness about what's going on and how people can stay safe in general. This is some more outreach that we've done. These are tabling events, and everyone, you always kind of think about tabling as like a passive activity, but really we are talking to every single person that shows up. We are, if they're not interested in Narcan, maybe there's something else that we can support them with. I have to give a shout out to Greene County Public Health. They work really closely with us, and they have done a really wonderful job on our opioid dashboard. If anyone has not seen it, it's an amazing resource and tool. It compares both of the counties. It provides up-to-date data on demographics, where people are overdosing. It's just a great tool, and it's used a lot in our social media campaigns, as well as any of our events, informational sessions, and beyond. This is some more capacity building, right? So we're doing these events with organizations, and a reason why we actually use MHACG is because the individuals who do the Narcan training are in recovery. One of them has experienced an overdose. In addition to providing this information, we're also addressing stigma. So a lot of these presentations are not just about learning how to use Narcan, it's about understanding why we need to have Narcan in our medicine cabinets, right?
It's such a strength. We do Narcan training at our firehouse for the whole community every year.
Yeah.
And I was at a lunch recently at someone's house, and another person came in and said, they have Narcan in their bathroom. Do you think they have a drug user in their house? And I said, no, they have 3 kids, and they don't know who those kids are going to bring to the house, or
Exactly.
you never know. But there was such a stigma. Who in the house has a drug problem because there's a Narcan kit?
Yeah.
And why she was opening their medicine cabinet, I don't know.
Yeah, that's it.
You might ask that. That's how you find out a lot about somebody.
Yeah.
But thank you, Supervisor, for giving that person an alternative perspective.
Yeah, it was just such a weird thing.
Yeah, because,
Oh,
we also work closely with Greener Pathways and Twin County Recovery Services. They really provide us with a lot of Narcan kits. They come to our prevention work groups, and we promote the work that they're doing. This is some business work, business capacity building that we've done. So we did a Narcan in Every Bar campaign last fall. These are some of the local bars and restaurants that are now trained and they have Narcan in their lives.
That's great.
These are some other businesses that we've been working with. We've also done some staff Narcan trainings with Cornell Cooperative Extension today, as well as Community Action. And again, we're not just training Narcan, we're addressing stigma and we're supporting people. I was not at the Cornell training today, but I was told that after the fact there were some staff who came up and disclosed that they were struggling and they asked for additional resources. So these trainings can be really beneficial.
The testing strips, people are really interested in having.
We have lots of test strips, yeah. And our recommendation for anyone who's looking to get resources is go to our website because we have a list of all the resources. And, you know, if you're an organization in Greene County, you know, go to Greene County, go to the public health there. If you're here, go to our lovely public health, right? So we really want to utilize what's closest to us. And then this is some school districts. Obviously, school districts are difficult to really kind of get into. And so any of the work that we're doing is really sensitive and supportive. And for instance, we went to the 7th grade Hudson health classes and we did a coalition building / stigma harm reduction presentation. And you can see that sunscreen is harm reduction. We played a really fun game about keeping ourselves safe without it being this like doom and gloom drug overdoses, right? So we can tailor any of the presentations or the workshops to the age and, you know, what they're looking for. Again, capacity building, we worked with Greene County Rural Health Network. We did, they were basically advertising for medication drop boxes. And so we were advertising for Prescription Drug Take Back Day. And so we combined our efforts and we were able to advertise together. We also are doing Spanish advertisements as well. This is some law enforcement work that we did. So we did partner with the Windham PD and Caro PD. We not only were we collecting medication, but we were forming relationships with these police officers, and we were also providing harm reduction to participants who showed up.
It's a lot of medicine that you 84.
And then this is just another list of really some of the other overdose awareness work that we've been doing. Greene County Medical Arts, Kelly Pharmacy, we provided these drug disposal bags to them for individuals who are at home and get their prescriptions delivered. So really taking into consideration health disparities and being able to meet people in different facets of their life.
That's another great one.
Yeah.
Have we seen any significant reduction in prescription medication getting into the hands of folks that it shouldn't?
You know, I don't.
Based on these programs that have been in effect now for several years, including like these givebacks, including these drop sites, is that having the intended effect?
I don't have data for that, but what I do know working with 2 different epidemiologists is that the first one was very against drug take back days. He basically said like, they're not evidence-based, they don't work. But at the end of the day, it's the awareness piece, right? It's the awareness, it's stigma, it's being there with law enforcement, you know, so that's a great question. And I will definitely look into it and see if there's something I can get, but I don't have an answer as to whether or not they work.
I think there's quite a bit of language in the data that we get about drug overdoses and the particular form. So even though it's been a few years and this has been done, I think there's a lot of lag before you can actually see that. So I think it's going to be well. I'm a retired physician. My own perspective is that there's been an enormous change in prescribing, so that, you know, people are much more likely to get a quote unquote prescription for Advil and Tylenol for pain, for minor pain, even after surgery. And previously that you didn't purchase that. So that's been a huge change for the past.
That 400 pounds is not out there for somebody to find.
Right.
It's not in somebody's closet or.
Not much less.
Right.
Well, and it's also not polluting the water system.
Right.
as
It's a
well.
big
That's
piece,
another
yeah.
element. The landfills get polluted, the water system gets polluted. So there's multiple benefits there, lots of different layers to it. I just think it's remarkable what
what's gone on.
And that's true because most people in our community didn't realize they were polluting their wells when they're flushing and stuff down there.
Yes,
Right, yeah.
yes.
And then this is a little bit more on what we're doing with regard to work groups. We have a prevention work group, we have a data work group, and we're also working on a marketing and communications group. And that's part of our capacity building as well. So that's pretty much it. I think there's one more slide after this, but I know we're past our.
No, you're fine.
Oh, okay.
We have a meeting at 5, but we're
We're
good.
in the schedule.
Oh, got you. Okay. So yeah, what's next? So continue to just get out there, build that awareness, connect with folks. Obviously continue to work on developing and implementing strategies, continue our data collection, partnering with organizations to host community events. We have funding for that. Media campaigns using local data. We continue to do that. Youth Coalition, and down the line, we'll be working on policies, but not for some time.
If we had a local business that we thought would benefit by having Narcan or Narcan staff training, could we send that to you or someone on your staff?
Yeah, of course. Yeah.
Just think about
Department of
truck
Health
stops,
also
you know,
does.
with all these-
They also do Narcan training, and that's on our website too. They have a form. So yeah, whatever someone prefers. I mean, I think it's really important to remember that with coalitions, we're not looking to step on anyone's toes. We're not looking to take away work from anyone. We're looking to fill gaps. We're looking to address under-resourced areas, under-resourced communities, and work more collaboratively to address this rather than everyone out of individual silos.
Yeah, that's an important point because Hannah's brought it to my attention. I've seen it firsthand where we have different groups of providers that are all well-intentioned. The best example I can give is, they each, organize an event, let's just say on the same day or really close to one another. And you expect your audience to then have to choose between which one they want to go to. Or they're all here in Hudson when there's nothing out there in more rural communities throughout the county. It's like, well, wait a minute, there's people that have needs out there as well. So what about them? So it's coalition can play a role in that as well, helping one provider know what the other provider's doing and then strategize as to how they can, operationalize their efforts in the most effective way, as opposed to just, two providers hosting something on the same day and just not being as beneficial as it could have been. That's happened actually. Right?
Yeah. And the opioid dashboard is up in the top right corner. The opioid dashboard is over to the right. Yeah.
This one right here. Right?
Yeah. And this is what we use pretty frequently.
It's loading.
Okay.
We're a little slow.
There we go. Yeah, this is fascinating information. I mean, the work that the epidemiologists have done to collect this, to load this, to pull from various resources.
I think what's also important about this data is that it's compared with local coroners. So they're getting more of an exact, if you go down to the substance use, you're getting a more exact cause of death for the overdoses. So there's a pie chart and it'll show like Greene County, for instance, Columbia County, for instance, has a higher rate of overdoses that are connected to stimulants and fentanyl, right? So that could be methamphetamines or cocaine that are laced with fentanyl, where in Greene County, we're looking at, fentanyl alone.
And that's a function of availability, or we don't know what the local provider has. It's an interesting difference.
Yeah, there's a lot of differences between the two counties, actually.
And another remarkable thing that stood out from this dashboard for me a while ago was the epidemiologist, when they were presenting, explained to us that it's literally virtually unheard of for a person to die purely from a heroin overdose. Is that right, still? It's more the fentanyl, the xylazine, the carfentanil, the drugs are being laced. So that was interesting for me to hear.
Heroin has become increasingly scarce, especially in Greene County. They're not finding it at all. I think also the demographics are interesting, especially for Columbia County. So last year, there were actually more females by one, I believe.
So heroin,
Heroin is like, it's not, we don't, I'm scared. We're not finding heroin. It's all fentanyl, yeah.
Probably because it was.
Fentanyl is people's drug of choice. Yes.
The tolerance has risen such, Bob, that the heroin is no longer effective. It's on to fentanyl, which we were all terrified of, years ago, and we still should be. But, the dependence, the tolerance is so high that it's now fentanyl that scratches the itch, so to speak, no longer the heroin.
Well, heroin doesn't really exist anymore, so it's not even that, it's just not even an option.
Excuse me, ladies in the back, would you mind just while she's talking? Stay silent, thank you.
okay, well, certainly.
So the suppliers have changed.
We'll have you, this is very interesting.
To the drugs, from Columbia County to Greene County, the differences, does it correlate to income? Does it correlate to, is Columbia County a wealthier county than, Greene County? I'm curious because I wonder, cocaine use, more expensive, wealthier people. I don't know if that's true or not, but there's gotta be some correlation to something.
So I don't know about that. I can't necessarily answer that question, but I will say that we did a Narcan training at Sleepy Hollow Lake Residence, which is in Athens, and that's this beautiful lake, and they have all these Airbnbs. And the day before we went, they had an overdose, and that was the third that month. And that establishment has a ton of Airbnbs. And what they're finding is that the homes that there aren't full-time residences where people are Airbnb for the night, they're partying and they're using hard drugs, right? So recreation. So we can't say that it's one demographic or another. I don't think when it comes to drug use, because there's recreational experimentation. The biggest piece is that if you're going to experiment with cocaine or even Molly or any of these like party drugs, there's a very high chance they'll be laced with fentanyl and or xylazine. So that's where test strips are important, right? And having Narcan.
Are we making kids incredibly scared of fentanyl in the schools?
I'm not talking to kids about fentanyl in the school, so I don't know. We did a presentation with seventh graders. We didn't talk about fentanyl. It was more about, working together, and it was age appropriate. So, but I really don't know. They did know a lot about fentanyl. The teacher had kind of educated. They didn't seem scared.
Shouldn't we make them very scared?
No, not at all. We shouldn't. I don't think we should make them scared because
That's not harm reduction.
yeah.
The scared straight approach does not work.
Offering the test strips and how to use Narcan, because these are kids that are directly affected by this also. So, that adds to the stigma.
Right.
As a scared straight.
Can we debate that at some other time?
Yeah.
The scared straight thing worked for my father and I.
Exactly. Me too.
All right, so we have just 2 or 3 minutes left. Any closing comments, Hannah, or closing questions for Hannah before we move on to public safety?
So much.
Thank you very much.
Yes, given the dramatic correlation between use and child abuse, sexual abuse, I was really pleased with the placement of a psychologist in schools. Is that something that's going to continue to expand? I'm sure there's no evidence space for that at this point, but it makes sense.
So the best answer I can give you in 120 seconds or less is that, yes, several districts have sought out psychologists, social workers, clinically trained staff. My department is also making a go of setting up clinical satellites in the districts. We have offered our services. My director's report talks about 2 districts that have welcomed us bringing a satellite to them. The governor's budget has offered increased reimbursement to mental health centers like the one that we operate for the county. That will certainly go a long way in helping those satellite mental health services in the schools be successful. So yeah, it can't hurt.
Terrific. All right, well, thank you so
Thank
much,
you
Ms.
for
Hannah
having me,
Calhoun. Coalition, motion to adjourn.
Motion to adjourn.
Second. Thank you, everyone. Good night.
Okay, I'd like to call the June Public Safety Committee meeting to order, please. Probation's up first. Mr. Graziano.
Good evening, everyone.
Good evening.
I'm looking to get authorization to accept the state fiscal year 2024 Raise the Age Grant Award.
Second. All in favor?
Aye.
Opposed? So carried.
Looking for authorization to accept the grant.
Move it.
Second?
All in favor? Opposed?
We don't like grants.
So carried.
Ray's not here.
And I'm looking for authorization to fill the budgeted probation supervisor
Move it.
position.
Second?
Second. All in favor?
Aye.
Opposed? So carried.
Thank you, everyone.
Thank you.
You.
Sorry, it took so long.
Sheriff?
Make bigger chairs.
How are you?
Good, how are you, sir?
I'm well, thank you.
How's everyone tonight?
How are you?
Fantastic, thank you. So the sheriff's office is looking for authorization, to declare surplus property, 5 vehicles total. The reason behind that, mileage is above 190, engine issues, rot, motor mount issues, transmission, there's no longer roadworthy. So looking to move those to surplus property.
I'll move it.
Second.
Second?
All in favor?
Aye.
Opposed? So carried.
Authorization for sheriff's office to enter a renewal agreement with Taconic Hills, Ichabod Crane, Germantown, Chatham, and Lebanon School Districts for the SRD program.
Move it. Second.
Second.
All in favor?
Aye.
Opposed? So carried.
Authorization to enter into agreement with Allpay for credit card machines in the Columbia County Jail and Civil Department. We found the need of individuals who no longer carry paper money to still pay these fees that we charge.
Move it.
This is free of cost.
Second.
Second.
All in favor?
Aye.
Opposed? So carried.
Looking for the Columbia County Sheriff's Office, which we applied for a grant in the amount of.
Second.
Should have said grant.
Grant. In the amount of $279,790. All in favor?
Aye.
Opposed? So carried.
Out of county inmate report, Dutchess County received $4,950, Franklin County $15,120, Greene County $4,650, Mays total $24,720, year to date $76,995. Compared to last year, significantly down, but that's based on the Dutchess County issue as normal. I did send Kelly, I sent you a late notice, and I apologize. The security services report, I just sent to your email, and I do apologize for not having that with me tonight. The current population of a facility is 39, housing 2 from Dutchess, 2 from Parole, 3 from Greene County, and 2 from Franklin. And the rest are currently are sentenced and not sentenced.
Any questions? Thank you, Sheriff.
Franklin County's a long way to some people.
We'll take it. Yeah. As long as we have to pay for the gas to get it. There you go. Thank you all.
Thank you, sir.
Enjoy the weather.
Conflict
Oh, yeah.
Defender, Mr. Porton. How are you, sir?
Good news.
I'm well, thank you.
Everybody.
Hello?
So we officially have a chief conflict defender, and we have an office, and it seems to be operating very smoothly. So, and we have an office upstairs set up, so very pleased to have you here. There's a report that Mr. Porton has provided. Are there any questions in regards to that? We are going to be working on setting up an 18B office as well, which I just sent an email out to indigency group. I'm just waiting for a job description back from them, and then we'll start on that. So are there any questions for Mr. Porton?
I've been trying to consider whether or not there could be some overlap there,
Right.
at least in the interim, so maybe we'll talk about that.
Okay.
So just silly question, but because this report format is new to me, assigned disqualified as in they weren't eligible for?
No, once we're assigned, or at least we're asked to get in on a case, we have to go through a vetting of our attorneys as well.
Right.
2 of the attorneys we have were from the DA's office.
Okay.
one, is doing primarily, family law, but if she's had she was a law guardian on a case or attorney for the child, she would have to be disqualified, or ultimately the whole office could be disqualified depending on one of those cases. So that's what the.
And then they go to another private
That's the
attorney.
ATDs.
ATD still assigned counsel, but so now there's two formal ways of having assigned counsel. The first is public
Public
defender,
defender.
and then if they disqualify, then it comes to us, and then we hopefully won't.
But if they did, it would then go to.
And how do the numbers below conflicted out criminal family relate to the numbers above? Because like the disqualified's 35, that's 31. Does that conflicted out number not match something above that line?
It doesn't always, because of sometimes it depends on a case, meaning an individual person. Sometimes it depends on how many charges are filed with one. So sometimes if you have a person that's 7 felons, for
Sure.
example, some of those felonies may get apportioned differently.
Okay, but essentially the conflicted out and the disqualified are kind of the same
Correct,
category.
yes.
It's just those numbers won't always. Thank you.
Any other questions? Thank you. Thank you.
Thanks.
Public defender, Mr. Zoni.
Yeah, right. Good evening, everyone.
Good evening.
I just came down, in case you had any questions about the report that I had submitted today. And if not, that's okay too, but I just wanted to come down.
Any questions?
Chance to review it.
Thank you.
And before we mentioned about financial eligibility,
Yeah.
that determination is made at my office.
Before it goes on.
And then it gets set. So, thank you.
Thank you very much, sir. All right, Mr. Keeler.
Afternoon.
How are you, sir?
I'm well.
Not a bad day yet.
First resolution is to appoint Gary Grimes from Stuyvesant Fire to our volunteer hazmat.
Move
team.
it.
Second.
All in favor?
Aye.
Opposed? So carried.
The next resolution is advocating against the current OSHA reform with New York State and the federal government. They're looking to redo the OSHA requirements for emergency services. Since 1980, they've been working towards this. Now they've started to push some of the rules out, and some of them are pretty overbearing. And we think they're going to have a pretty negative effect on some of the volunteer services.
And if I could just say something on this, I was at a Association of Towns Supervisors Roundtable. I know some of you also attend sometimes, and this topic came up. And it would be really onerous on our volunteer firefighters, and although safety is very important, it seems to push the needle too far in the direction, even currently with the regulations
Some of the-
becoming interior.
Some of the
is
stuff
already-
we're currently doing now, which is we've adopted since 1980, but they're looking about 150 more hours of record keeping for the agency having jurisdiction. They're looking at higher training requirements for line officers from 1 year to 3 years. So it's just going to be pretty hard for us to manage with limited labor pool to begin with that's free. So
I'll move it.
Second. All in favor?
Aye.
Opposed? So carried.
we'd like to accept the donation from Glowing Memorial Health of 2 EKG machines and 2 exam tables to help us facilitate our fledgling firefighter physical program that we're working on.
Move it. Second. All in favor? Aye. Opposed? So carried.
Along the same lines, we'd like to authorize to be able to contract with Emergency One out of Kingston to help us with our first round of physicals. We've been examining, trying to do a secure portal for patient information and all that, and they already have that program in place. We're trying to work through the Department of Health to try to piggyback on their program, but that's not going quite so well yet. But we're still working through that, so we'd like to use them police to get we've got some fire departments that need physicals, so we'd like to get them out of the way.
Second.
All in favor?
Aye.
Opposed? So carried.
Well, there's our activity report. The other thing I just wanted, a couple of topics I just wanted to touch base with you quick so you know what's going on. We've been working with Public Works and Solid Waste on lithium ion battery problems through the waste stream. So we're working on some training for them and some handling procedures. And along those lines, we'd like to be able to pursue a cooperative buying program through the county with the fire departments to be able to purchase some equipment and some chemicals needed to handle some of these emergencies locally. No, we don't anticipate a cost to the county yet. We're gonna try and just do a reimbursement program if that's all right. So we're trying to work through that program now. Okay. Well,
There was no, but thank you.
Oh, I agree.
Okay.
Oh, you're-
We agree.
Yeah, yeah.
Well,
Okay, do it.
I've had a lithium ion battery and one of my hand tools catch on fire.
Yeah,
Oh.
it's pretty scary. It's pretty,
Throw it on the lawn and wait till it goes out.
it's pretty violent, pretty hot, pretty noxious. Yeah.
Great, any other
It's
questions?
Scary.
Yeah.
And that's a little battery this thing.
Thank you. All right. Director Harris?
Thank you. Good afternoon. No requests, reports there, in addition to an earthquake and solar eclipse. We also had the geomagnetic storm, which didn't seem to have an effect on our county and our hazard
See the
mitigation.
northern
plan.
lights.
What's that?
I could see the northern lights that night.
Yeah. and There were rumors that some people went a little overboard.
No.
That wasn't proved. As the hazard mitigation plan update is going as proposed, it's staying within its schedule, so hopefully it'll be submitted to FEMA by September. Of course, then it could be anywhere from 6 months to a year before FEMA approves it, so. But that's it.
Any questions? Thank you.
Thank you, sir.
District Attorney,
Afternoon.
Good
how are
afternoon,
you?
sir.
So I just have a photocopier resolution for you to, for a lease for a copier to replace the copier that has reached the end of its life.
I'll move it. Second.
All in favor?
Aye.
All right, opposed? So carried.
Thank you very much.
Thank you.
Thank you, sir.
Proposed local law animal abuse registry.
Rob, if I could,
Sure.
say a few things. So the last time this came up, I jumped right into it. Obviously, the goal of preventing animal abuse, the goal of preventing potential other crimes is one that I think would have unanimous support. Supervisors committees brought up some potential questions regarding how this type of system was, and in looking into it, some of the data that is out there. So the ASPCA doesn't support this approach. They've found it's ineffective and costly, creates a false sense of security that animals and people are gaining protection from possible offenders. And they offered several alternative approaches that are already widely in place that could potentially achieve the goal, which is to decrease animal abuse, decrease repeat abuse. Some of the things that they're recommending that they see as more effective is mandated psychological assessments and inclusion of pets in domestic orders of protection, strengthening and broadening existing animal cruelty laws, making an effective use of well-enforced no-contact orders. Some of the concerns they bring up with this approach, it can be expensive, have a limited reach, and be rarely utilized, limited in scope, and don't offer real protections for potential victims, and may decrease the prosecution of serious animal cruelty cases. Not removing potential access to pets can create a vigilante mentality, put additional burdens on animal shelters, and when they compared to other registries that are similar to this, such as a sex offender registry, the data doesn't actually show that it decreases recidivism of registered offenses. So I am happy to share the SPCA's website that talks much more in detail. These are just my notes, my bullets. But I think oftentimes when we hear of something, we want to stop animal abuse. Of course we do. And so that was my initial, yes, let's do this. But I would like time to look more into this. I don't know if you guys are familiar with the SPCA's take on this type of program and have any data that you can share with us that kind of counters some of the oppositions that they have in place. But I don't feel comfortable moving forward with something that is potentially expensive and not useful.
We already did this.
We went
Yeah.
through all this. So I mean, what I was gonna say was that this has been on the table for a long time. We've gone through this process. I think it was vetted through the sheriff's department. It was vetted through the district attorney's office, which if you have any comments, like to hear them. But I mean, we've had this.
Well, it came to full board. They came and did a wonderful presentation. Like I
They've
said, I
been to
was
this
fully on
committee several times.
board, but Michael brought up concerns at that meeting, and I don't think it's been discussed since that full board
No, it's
meeting.
been discussed. It came to this committee.
I think it's been discussed, it just hasn't been, those points just haven't been responded to. I guess what I'm hearing is that, right, like, the ASPCA has said they don't find it effective. I can add in the American Kennel Club also said, for the similar reasons, they emphasized the burden it potentially put on the people who have the animals they're trying to give away. So you could look at the specific local law, that it's sort of vaguely written, but it's like if the person with the animal doesn't follow the law, they can go to jail for up to a year, and they can get a $5,000 fine. And it's fairly unclear the burden that they have to meet, right? It's like if they look up someone's name, is it, and someone's like, no, that's not me, that's somebody with the same name as me who lives at a different address. Is the burden on the person who's like raising puppies to then like check all the different counties around and match someone's name to their address, to like look at their ID and compare to the picture on there? It's a pretty high standard, and potentially someone goes to jail for a year if they it puts the burden on people with animals that could do all these checks, that it's really unclear if the materials are there, or if they just don't even know about the registry, or they don't know to check. I don't know, it says contiguous counties. Do they know how to check the Connecticut registry, and is that a contiguous county, or is Albany contiguous county because it's diagonal? I think there's a lot of vagueness that I think puts a potential going to jail burden on people with animals.
I have a question about the process that's envisioned by the law, and that has to do with the requirement that somebody who is found to be guilty of one of the enumerated charges is required within 5 days to register. Is there a reason why it was written to not have that process initiated at the court? Because otherwise what has to happen is an ADA, presumably somebody from the office, contacts the sheriff's office. And if the person doesn't show up in 5 days, they then have to go out and get them, presumably, right? And if it were done right at the courthouse, it would be one and done, and the person would be registered right away, except for, there might be some technical stuff like a picture. Well, they could do a picture there, presumably, right? I mean, it's not a big deal to take a.
I just don't think they have the abilities at the courthouse to go through the process. Not that they couldn't come up in a room and be dedicated for that, photographs and so on and so forth. But I think they were just probably more readily capable at the office in order to handle that much like sex offender.
Understood, just that it seems that it takes, it puts an extra burden on your office, which obviously you're willing to take. But, now you have these people wandering around, and if they don't come in, then you have to go get them if that's what you're gonna do. And the question is, are you gonna
The burden of the big machine.
Yeah, that's right. Yeah, I got it.
Originally, a lot of these questions came up, and then we sort of slowed this down. And we asked the sheriff's department his feeling on it, because some of the thoughts I even had at the beginning.
The county attorney
looked at it. I could be curious to hear what your thoughts are on this, Mr. DA.
Well, I guess I can address one concern, which is as far as, there was one thing that I did ask to be removed, and that involved, there was a requirement previously that forbade the district attorney from pleading out of the animal abuse registry. And I asked if that provision be changed, because I thought it was an improper limitation of this office's authority, but also because there are going to be cases where, I don't remember, Tisha, maybe it was you who raised, it was Michael, that, somebody essentially made a mistake through the vetting process, or they got the wrong person. So those would fall into the area of prosecutorial discretion, where you're not necessarily in that case can have proof beyond a reasonable doubt to convict somebody. So with that change, I was more comfortable that based on the facts, we're going to be able to view the case in its totality and determine how to proceed. And the way that it's written now, as I understand it, is that if we do take a plea that goes outside of the animal abuse registry, then we put the reason on the record, which is comparable to what we do in DWI cases. So that is just to address a little bit of the concern about, let's say, maybe over enforcement or overly aggressive enforcement. There is some protection there.
If I could address your concern, there are currently 22 counties in New York State that have animal abuse registries. Some have had them for many, many years. Some are new. We are going to bear the burden of checking the registry every time we adopt. And that's just not a matter of checking this registry, but checking the registry we adopt to other states. We need to check registries in other states as well. It's the resident state that a person would be registered in where the abuse happened. And we accept that responsibility. And we know other organizations that would do that as well, because we think it's that important. If one person who's on the registry tries to adopt and is denied, then we've saved an animal from going back to an abuser. So I don't know why the ASPC is opposed. I don't know why they would take such a firm stand. Our hope is that at some point in the future, there'll be a New York State registry, and then all these county registries would be gone. There'd be one place to go. But it does say in this law that on the website, it's going to give you links to all of the other registries in New York State, which would make it easier to find them.
So just a quick, the sheriff, you support this?
Yeah, I mean, transparency, Wendy does work for the sheriff's office. We put that out there first and foremost. It has nothing to do with our support of this. ASPCA, the American Kennel Club, don't do a lot of the enforcement here in Columbia County Sheriff's Office does. We train the divisions because our agency that handles animal cruelty. We see them quite often. Horrific. And I believe that the people who are adopting animals out should have gotten good of,
He's getting too excited.
a cure spot of it. But, I think there should be a burden and some responsibility to say, well, we're just not going to adopt this animal out to this anyone. I mean, when it comes to anything else, when you're purchasing a firearm, you can't just say, okay, here's this firearm. This is a life that we're talking about. And evidence has shown that cruelty to animals a lot of times progresses into cruelty in humans. So I think it's important that we understand and we can get more data collected on, that type of actions, and as far as recidivism goes, if they're on the registry and they're not able to get it, well, clearly they're not going to be able to reoffend. So I don't see how those two things correspond. You can't get access to what the crime is. Clearly, you're not going to be able to reoffend. But the sheriff's office is going to have a lot of burden. We're going to take on that responsibility. The DA is going to be hearing more cases. I won't speak for his office, but since the inception of his term, we've been extremely aggressive about handling these cases. And, I think it's no brainer. We need to protect wildlife so that things are not otherwise.
Yeah, I think everyone's on the same page with that goal. I just wonder, so the effectiveness, you said 22 counties. Do you have data from before they adopted the animal registry to after that show?
You do? I do. I just was going to say it's actually 17 counties because 5 counties are New York City. So if you count New York City as one, then it's 17 for the state. Of those, I just checked the 2 adjacent to us. Greene County put a law in effect 3 years ago. There's 0 registrants in their database. Dutchess County did 5 years ago. There are 10 that were registered in a 5-year period. So that's one of the ASPCA's major points, is that this does not have a return on investment. It's a very expensive database to instigate. It's harder to maintain, and it's rarely used. So, and the answer to your question, I think their primary position was that there's so many other ways to access animals that adoption shelters are only one. So you may be putting a plug in an animal shelter, but all of the other ways to access animals through breeders or friends or neighbors, or you're not making a dent.
Breeders are.
Yeah. So you're not making a dent in how people, whether repeat offenders have access to animals.
Green County is, they have, since the inception in 2021, their animal abuse registry, they are currently active with 2 open animal cruelty investigations. And I'm very close with the captain over there. We go to events with Green County. And my understanding with the sheriff and the DA over there, once these cases are, once they're convicted, if they're convicted of the charges, then they will be added to the registry.
Right, but as of today, the registry is no convictions, no one on the registry.
I would ask everybody to look at the front page of the Register
Yeah.
Star today
Yeah.
and see the horse that's maltreated over in Greene County.
That's gonna be a third one.
Yeah.
The other 2 that I know about were both Phillips.
It's pretty sad, but
Wouldn't the horse not count anyway? 'Cause it's a farm animal. This law doesn't include farm animals.
Domestic animal.
I think that the emotional argument to be made is not one that anyone is doing. Like, when this first came forward, I said, oh my God, yes, let's do this. I don't think the question of whether animal abuse is important to stop or that it occurs and it's really bad, I don't think there's any debate there. I don't think there's anyone in this room that would disagree. My question is about effectiveness and bang for our buck. So for example, I guess this would be directed maybe at the DA. The SPCA recommends mandated psychological assessments and inclusion of pets in domestic OOPs, strengthening and broadening existing animal cruelty laws. If we were to take the same time and energy and money that we're going to invest into this program and instead invest it into those alternatives, my question is, which is going to be more effective?
Well, when you say time and money, what is the cost to do this? Well, when we keep talking about cost here, what is the manpower?
Well, once you establish. the
Right, I mean, so
registry-
what we saying that it's a big cost, what is the big cost to do this?
Setting up a database, a website,
Monitoring
process
it.
in the sheriff's department.
We've asked that question for months, if that was a owner's task on the sheriff's department, and you've said repeatedly, no.
I don't think it's going to be that easy. You know, we're getting a handle now on our staffing, crisis that we've been experiencing, form by term. You know, we're branching out in different aspects, and Offender Watch now with the sexual offenders is helping greatly consolidate the sexual offender registries. We have, you know, intimate knowledge of how these registries work, you know, through years of, the sex offender registry. Once we get a handle on it, I think the setup's gonna be the biggest part. But we're not gonna know if it's gonna work until we get.
Yeah, I mean, and all of these other things, and I'm not making light of what you're saying, but those take a tremendous amount of energy, money, time to try to to implement some of those things that you're talking about. And they may not ever get implemented. This is a step that's a fairly easy step. And again, in the beginning, I wasn't really on board for this, but I'm an animal lover. If it saves one pet, it seems to me, it's at least one step in the right direction. All these other things, sure, we can try to take them on, but I think as the DA would tell you, you know, when you start talking about mental health evaluations, and it's not realistic.
Well, I mean, you know, to respond to that, as far as, you know, aggressively enforcing the laws that we have, you know, if we have the appropriate animal abuse or neglect case, certainly we can ask for and require psychological counseling evaluation. That would be part of our normal process. We can, and we do pursue aggressive orders of protection. So I don't see it as an either or in this case, I wouldn't look at this registry as something that is undermining other, let's say what the ASPCA might call more effective methods of animal protection. I think we're already doing those things, and the existence or non-existence of the registry really does not affect how we handle those cases, how we pursue orders of protection, how we mandate conditions on conviction.
Sorry, I just really don't want to get into the public right now asking questions. If it's a supervisor or if it's the DA or the sheriff's department, I'd be happy to
It's not a question,
entertain.
it's an offering of information.
Go ahead.
I'm Louisa, like I work in family court and, on orders of protection, it's been recent, and I don't know if there's authority for that, but judges have put in orders of protection generally in the domestic violence setting to not harm the victim's pets. And so when that comes up as a matter, and that's something that can go, that takes no money to do that. And that's really important, like the sheriff was saying, I mean, that progression of the terror of a victim thinking that their spouse is gonna kill their animal, and then the progression to violence against.
And those can be written into orders, criminal orders of protection. I was a judge. I mean, you can write those in, don't harm the pets, don't do it. So it can be put in presently. I just feel like, I'm not trying to shove this down anybody's throat by any means, but this has been going on. We have a committee, we can vote on it. If it passes, it passes. If it doesn't, it doesn't. But I do think that we have given this a lot of time. We put some energy into this. We put money into this. The county attorneys looked at it. DA's looked at it. Obviously, he's made comments. The sheriff's department's looked at it. So I'm going to entertain a motion to adopt the local law filing.
And that would have to be voted on at the next board meeting.
Correct. And would be voted on at the next board meeting. I mean,
Well, you'd have a public hearing because it's a local law and then voted on at the full board.
so this would just be to move this forward. If it doesn't pass at the board, if we get, some other things that come up at that point, obviously, but I think at this point, it should come out of the hands of this committee.
I'll make the motion to move it forward.
I second.
All in favor?
Aye.
Opposed?
I'm opposed.
No comment?
You're good.
Yeah, okay.
Chairman, I'm going to ask a quick question.
Sure.
DA, can you give an example of pleading out of the registry? What would something like that be?
Yeah, well, so let's say there's a circumstance where an individual is accused of abuse or neglect, but we have weaknesses in the case, for instance. And so we have serious doubts about our ability to prove that abuse or neglect at trial. So there might be an instance there where the defendant is willing to accept a plea bargain where they get, let's say, a disorderly conduct, but they have to do community service and they have to do counseling. So we make sure that public safety is protected. We make sure that the person is getting if it's treatment, getting some treatment or whatever it might be. But at the same time, acknowledging we don't have the ability probably to take this case to trial and get a conviction. And so that would be the case where, we would then be required to stand up in court and say, we are pleading out of this, pleading off of an animal abuse or neglect case because of evidence issues, for instance.
So that
Does that
person,
make sense?
that person would not be registered because you've changed the plea.
Right, exactly. And that was sort of, that was the thing that I brought up because in certain instances, we need to be able to do that as a matter of discretion. And I think as a matter of fairness.
The original law did not give you the ability to do that, correct?
Right. And I suggested the change to putting on the record, the reason for doing that because it matches a change that was made, I don't know when, to the DWI laws, for similar reasons.
Are there any other questions? Sure.
I just want to leave the committee with one thought, and that is I really think that the ASPCA is kind of the gold standard for, animal cruelty and adoptions and sheltering and all the rest. And the fact that they took the time to do a position paper on this because they felt it was not effective is something I think that we should consider when we vote on this as well. Thank you.
Any other questions?
Thank you.
Thank you very much.
There we go.
Hey, before I ask everybody else if there's any other questions, at this point, I want to thank Tistria, and I want to thank the full police reform committee that we worked with Tistria started on that about a year before I got involved. And then Tistria and I worked together on that, and I'm happy to say that we've handed off all of the documentation. We've met with the Citizens Review Panel twice. They have all of the paperwork. It's going to take, we figured, till about July 1st before everything is posted on the website and everything gets out to the town halls, et cetera. But a lot of good work was done on that. And so that will be in effect hopefully by the beginning of July. So thank you for all the work on that as well. Is there anything else from the committee?
Just to piggyback on that.
Yeah.
The citizen review piece was happily handed off. I think we have a great panel.
Yeah.
And I'm glad that they'll be continuing that work. I do want, and I haven't yet gotten it all together, but I do want to make sure that this committee, now that police reform is no longer, this committee is tasked at reports, not creating the reports, but making sure we're getting reports and certain data and certain follow-up steps. So I will work, Rob, on compiling a list of what that plan, on an annual basis, we'll get this type of report. One is actually from Citizen Review. We asked them to get it up to us year end, December,
Yep.
January, because they were just starting now in June. But there were some other data points too that I just want to make sure now that police reform doesn't exist anymore, that we're tracking, and so I'll send it to the two of you.
Great, thank you.
To follow up.
Anything else?
I'll share my appreciation for like, I know that was like a complicated project, so thanks to the.
You're welcome. Thank you. Anything from the community, anything from the public? Motion to adjourn? So moved. Second?
Second.
All in favor? Aye. Opposed? So carried. Thank you, everybody.